Hey guys, how's it going? Dr. Andrews here, chiropractic neurologist at PC Wellness Centers. So we're going to talk about carpal tunnel syndrome, what it is, the symptoms, and I'm going to give you guys some cool little stretches and techniques and things for relief to do at home. But first, I grabbed my esteemed colleague, Dr. G, to help me shoot this video. I was just in with a new patient and they self-diagnosed themselves, like a lot of our patients do, with carpal tunnel syndrome, but she was completely wrong as far as her symptoms and what she was suffering from. It wasn't carpal tunnel syndrome. A lot of people are really confused about the symptoms. A lot of people don't have it, but a lot of people do. So I'm going to go over first anatomy, okay? So carpal tunnel syndrome obviously is in your wrist, all right? And the carpal tunnel is right in this area. So the floor of it are these carpal bones, and the roof of it is a little ligament that runs just like this, okay? And then through that tunnel runs the tendons of these flexor muscles. There's 8 tendons. And then one big nerve called your median nerve, okay? And that nerve, when it goes through, it supplies your thumb, your forefinger, and your middle finger, part of your middle finger, okay? So, to get carpal tunnel syndrome, one of two things happen. Either the tunnel has to get smaller, maybe from one of these carpal bones misplaced or arthritis, or the things inside the tunnel swell up, which is most common, okay? So these tendons can get bigger from repetitive stress, from doing things over and over and over, typing, hammering, working, whatever. And when those tendons swell, then it pinches on that nerve that runs right through this tunnel. And then that's what gives people the symptoms. So the symptoms typically are numbness and tingling in these 3 fingers, most often at nighttime, really when inflammation sets in. It may hurt, when you tap on this area. It may hurt when you rest your wrist down on a desk. So those are the symptoms typically, okay? If you have symptoms in these fingers, all right, your 4th and 5th finger, or in your palm or up your forearm, you really don't have carpal tunnel syndrome, okay? It's just these 3 fingers. So a lot of people have numbness and tingling in their whole hands and they say, I think I've got carpal tunnel. You don't. It's just these 3 fingers, okay? So treatment options, what we typically do in our office, chiropractic adjustments, number 1. Like I said, we want to make sure these carpal bones are where they should be. And then we'll do stretching. We may send you home with a brace at night. Dr. G shot a great video on laser, okay? Our laser is probably the most beneficial thing for carpal tunnel syndrome and getting down in these crevices and heating it up and bringing blood to the area and helping heal these tendons that are injured. So watch that video if you haven't watched it yet, because it's really cool. And then, again, I mentioned exercises and stretching. So I'm going to give you 4 real quick to do at home if you know you have it or if you're suffering from this. So number 1, I'm going to switch hands just for camera. Tuck your thumb in your hand and grab it and then just kind of move it up and down, okay? That will stretch the sides of the carpal tunnel, all right? Number 2 good stretch to do is put your hand on a wall with your fingers flared out, and then just kind of walk forward. And you may feel a stretch in your shoulder, that's okay, but you'll also really feel the stretch in these flexor muscles, which we're trying to stretch, okay? Third exercise. What is the third exercise? Oh, third exercise. Now we want to stretch these extensor muscles, okay? So make a fist and just grab it with your other hand and just pull down. All right, that'll stretch this other side. And then what we want to do is you can get a little massage ball or a racket ball or a tennis ball or something that moves or can glide over your skin real easy. And you just want to really massage these areas. You can even set this on a table and just run your hand back and forth. But just 1 or 2 minutes of massaging these flexor muscles, which are usually more tight than these other areas. Okay? So those 4 stretches, get in, see us, get a proper exam, any additional advanced testing if we need to really prove it's carpal tunnel syndrome. And then we'll go from there, get you healed. I appreciate you watching. We got your back, guys.